China reports 7,000 cases of Chikungunya virus, a growing public health concern. In recent weeks, China has reported over 7,000 cases of Chikungunya virus, signaling an alarming health threat across multiple regions of the country. This outbreak has raised global concerns about the spread of the disease, its impact on public health, and the vulnerabilities of specific populations. While Chikungunya is not a new virus, the number of reported cases in China marks a significant increase, warranting further investigation into its spread, severity, and prevention strategies. What is Chikungunya virus? Chikungunya is an arboviral disease caused by the Chikungunya virus, CHIKV, which is transmitted primarily through the bites of Aedes mosquitoes, specifically Aedes aegypti and Aedes albopictus. The virus was first identified in Tanzania in 1952 and has since spread to various parts of the world, particularly in tropical and subtropical regions. In recent years, the incidence of chikungunya has increased globally, with numerous outbreaks reported in regions such as the Caribbean, South Asia, and Africa. China's latest case reports highlight a rising concern regarding the spread of this disease in Asia. Pathophysiology of Chikungunya virus. Once a person is bitten by an infected mosquito, the Chikungunya virus enters the bloodstream, where it can spread to tissues such as muscles, joints, and skin. The virus is self-limiting, meaning that in most cases, it resolves on its own after a few weeks. However, the virus can trigger a strong inflammatory response, particularly affecting the joints, hence the name chikungunya, which means that which bends up in the local dialect, referring to the intense joint pain and stiffness associated with the disease. The virus primarily infects fibroblasts, which are cells that form connective tissue, and monocytes/macrophages, white blood cells involved in the immune response. These cells secrete inflammatory molecules like cytokines and chemokines, leading to fever and joint pain. Mode of infection. Chikungunya is transmitted exclusively through the bite of an infected Aedes mosquito. The mosquitoes become infected when they bite a person already carrying the virus. The virus then replicates inside the mosquito and, after an incubation period, is transmitted to other humans when the mosquito feeds. Unlike other diseases spread by mosquitoes, chikungunya does not appear to be transmissible through person-to-person contact, though it can occasionally be spread via blood transfusions or vertical transmission, from a mother to her unborn child. Signs and symptoms of chikungunya virus. Chikungunya typically has an incubation period of 2 to 12 days. The most common symptoms of the disease include 1. Fever, sudden high fever, often reaching up to 104 degrees Fahrenheit 40 degrees Celsius. 2. Joint pain, severe joint pain and swelling, particularly in the wrists, ankles, and knees, which can last for weeks or even months. 3. Rash, a maculopapular rash, flat, red rash with raised bumps, often appears within a few days of fever onset. 4. Headache, persistent headaches are common. 5. Muscle pain, muscle aches and general fatigue. 6. Nausea and vomiting. Gastrointestinal symptoms may also be present. While the disease is generally self-limiting, with most individuals recovering within 7 to 10 days, some may experience prolonged joint pain and fatigue for weeks or even months after the acute phase. Treatment options. There is no specific antiviral treatment for chikungunya virus. Management primarily focuses on relieving symptoms. Key treatment options include pain relievers, non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen or paracetamol can help reduce joint pain and fever. Hydration. Ensuring adequate fluid intake is crucial, especially if the person has a fever. Rest. Proper rest and immobilization of painful joints may be advised to reduce discomfort. In cases of severe complications or co-infections, antiviral drugs and other treatments may be considered, but the focus remains largely on supportive care. Complications of chikungunya virus. While most cases of chikungunya resolve without complications, some individuals, particularly the elderly, those with pre-existing medical conditions, or infants, are at risk of severe outcomes, including chronic joint pain. Some people experience prolonged joint pain and inflammation, which can last for months or even years, a condition referred to as post-Chikungunya syndrome. Neurological complications. Rare cases have reported neurological issues such as encephalitis, brain inflammation, or Guillain-Barré syndrome, a condition where the immune system attacks the nerves. Hemorrhagic fever. In rare instances, the virus can cause bleeding and more severe symptoms. Organ involvement. Severe cases can result in liver or kidney damage, though these are extremely rare. Vulnerable populations. Certain populations are more susceptible to the severe effects of Chikungunya virus, including elderly individuals. Older adults are more likely to experience severe complications, including prolonged joint pain and other comorbid conditions. Infants and young children. These individuals may face an increased risk of neurological complications. People with underlying health conditions. Those with heart disease, diabetes, or immunocompromised states are at higher risk for severe disease progression. Pregnant women should also be cautious, as the virus can be transmitted to the baby in rare cases, though birth defects or stillbirths have not been widely reported. How deadly is the current outbreak? While Chikungunya is not usually considered a highly fatal virus, deaths are rare, especially when adequate medical care is available. The current outbreak in China represents a growing public health issue due to the number of cases being reported. The 7,000 cases suggest widespread transmission in certain areas, and the true scale could be larger as cases continue to emerge. Although fatalities are uncommon, severe cases can result in significant disability due to prolonged joint pain and inflammation. The economic burden of the disease, especially in terms of medical costs and productivity losses, could be significant. Prevention and control measures. To control the spread of Chikungunya, vector control remains the most important preventive measure. Key strategies include mosquito control, reducing mosquito breeding sites by eliminating standing water in and around homes, using mosquito nets, and employing insect repellents. Public health awareness, educating the public on the symptoms of Chikungunya and the importance of avoiding mosquito bites. Early detection and surveillance, monitoring and reporting of new cases to identify outbreaks early and deploy resources effectively. In summary, while Chikungunya virus is not typically deadly, its increasing presence in China and other parts of Asia warrants close attention. Public health efforts aimed at controlling mosquito populations and educating vulnerable populations will be key in preventing further spread and mitigating the